The results of a genetic test fall into one of three different categories. One possible result is negative, meaning no inherited gene mutation was found. Another possible result is positive, meaning a gene mutation was found that increases the risk of breast cancer or other cancers. Finally, a variant of uncertain significance result, or VUS, means the test result is not clear. It's important to keep in mind that a negative test result doesn't mean a person isn't at risk for breast cancer. In the US, only about 5 to 10% of breast cancers in women come from inherited gene mutations. So, if you get tested and have a negative test result, you likely have the same risk of breast cancer as most women at average risk. However, it's recommended you talk with your healthcare provider to understand your risk and follow the screening plan that's right for you based on your age and risk. While positive test results do indicate a person is at increased risk for breast cancer, and possibly other cancers, they can't predict when cancer may develop or if it will ever develop at all. A person with a positive test result for a genetic mutation should discuss their options with their healthcare provider. A variant of uncertain significance, or VUS, result is inconclusive, but is probably negative. This result can be confusing, since it's unclear whether it indicates an increased risk of breast cancer. However, the test shows a minor change in the gene that needs more study. Although we know about BRCA1 and BRCA2 genes, information about other high-risk genes is limited, so VUS results are common with multi-gene tests. However, remember, having a mutation doesn't mean a person will get breast cancer. In fact, breast cancer screening for women with a VUS is typically the same as it is for women at average risk of breast cancer, but it's best that they talk with their healthcare provider to develop a screening plan that's right for them. One thing you can do if you have a VUS result is to check with the healthcare provider or the hospital who ordered the test every few years to see if there's any new information about the VUS. While this may seem like a long time to wait, the information isn't likely to change very often. If you're found to have an inherited gene mutation, there are special breast cancer screening recommendations. For example, the National Comprehensive Cancer Network recommends an annual breast MRI for all women with BRCA1 and BRCA2 mutations starting at age 25, and then combined screening with a mammogram starting at age 30. If a woman gets both a mammogram and a breast MRI every year, her healthcare provider may spread them out, so she has one test every 6 months. For some women at high risk, a breast MRI combined with mammography is better at finding breast cancer than mammography alone. Talk with your healthcare provider about breast cancer screening. Together, you can make a screening plan that's right for you. Some women may also take a risk-reducing drug or have a risk-reducing mastectomy, which is the removal of the breast to prevent breast cancer. Clinical trials may be an option for screening or risk reduction. To learn more, you can visit the Risk Factors section on Komen.org.